Hello, hello, wonderful technologist. Welcome back to the CAT Scan Guru podcast. I am your host, Karina Hogan. So welcome back, everybody. Hope you guys are having a amazing week. So I know I say this on every episode, but I am so ready for summer because you have no idea what it's like living in the Midwest. I am not from the Midwest. I am from the West Coast. So I grew up in the West Coast and I'm used to desert and 100-degree heat. So I know you guys would think I'm crazy, but this desert girl cannot handle snow, black ice, and all that it entails here. But unfortunately, I am stuck in the Midwest, due to joint custody and things like that. But I just want to personally thank everybody for continuing to purchase the CT Core Protocols Guide and the pocketbook that fits into your scrub pocket. These are some amazing resources. So of course, I've taken all the protocols that I have done over the years, taken them out of my little brain and put them into these resources for you. So you can get a digital copy or a hard copy of either one of them. Everything is linked in the show notes. And when you purchase either the protocol guide or the pocketbook, doesn't matter if it's a hard copy or a digital copy, you will get access to 2 courses plus a audio series that I do teach absolutely for free when you purchase either the pocketbook or the guide. So make sure you guys get in on that action and make your CT training a success. Also, make sure you follow along on TikTok because I do a lot of protocol videos and a lot of education and just, I share some personal things sometimes on my TikTok channel. So make sure you guys check that out as well, okay? And check out the YouTube channel for all your educational needs in CT for the new CT technologists and even you experienced technologists. I know I've gotten comments about having like a refresher course, which is something that I'm working on as we speak. So stay tuned. That will be available very soon. On to today's episode. We're going to be talking about what confident CT technologists do differently. Okay. So we're going to be talking about you, the confident CT tech, what you do differently versus anyone else. So what I mean is that a new CT technologist, they may be lacking confidence, they're unsure, or they second guess themselves, or they overthink, versus somebody who is confident in that role and how they do things differently. So confident CT technologists aren't guessing, they follow a system. So when we are confident in our skills, we are confident in our job, and we're confident to making sure that we take care of our patients in the safest possible way, we follow a system, okay? So one of the problems that I see when I see a technologist that doesn't seem very confident or they're a little fearful is sometimes people think that confidence equals their personality. Like you can be an amazing person and have an awesome personality and absolutely just be unsure in your job. Because we see that too, okay? So what does that do? It creates a lot of overthinking. And, somebody who is not confident overthinks a lot and overdoes. And sometimes when you overdo something, you can make a lot of mistakes. There's a lot of hesitation, like, oh, should I do this? I don't know if it's right. And you're second guessing yourself all the time and not being sure and just taking the time out to say, okay, if I do this, this is the result. But you're hesitating and you're second guessing a lot. And then what that does is you add more stress to yourself. And then you're stressing yourself out because you don't know if you're making the right decision or not. And then there's fear behind that. So those are the things that we don't want. And we want to make sure that when we train our new technologists, that you are confident in your skill set and confident while you're in that scan room with the patient and you're confident behind that console, making sure that you execute the exam before you press that button and that contrast button. So let me tell you where confidence comes. It comes from a structured workflow. Okay. It comes with repetition and understanding and with clear logics when it comes to protocols. So when we have a structured workflow as far as how you execute your day, how you train properly, what you should know first, and then what you should know next, and then making sure you practice and repeat those exams. Like there are some core exams that every technologist should know. You should know how to execute a head without contrast, no problem. A PE study, an abdomen and pelvis with contrast, because those 3 exams are your bread and butter. Even a CT of the C-spine. because it goes right hand in hand with a head without contrast. And it's usually for a fall. Okay. The next one should be like a CTA abdomen and pelvis. Another one is an entire stroke protocol. And when you repeat and use repetition and practice, you will understand more on the logic behind it. And those protocols will be nice and clear for you. When you have a structured workflow on, okay, I'm starting my training. This is what I need to know first. This is what I need to know next. This is what I need to know, which I have an awesome 8-week checklist that you can get in the show notes on how I think you should structure your training. So it's like a free checklist that you can go by. Okay. That is merely a guide for you to follow. So when you have those things and you have those patterns as a confident technologist, what happens is you're calmer under pressure because CT is very stressful and we're very freaking busy. Okay. I can't tell you how many stroke protocols at my hospital we run and how many traumas because we are a level 1 trauma center. And then your workflow becomes a little bit more structured. It becomes a little bit more quicker. And you have that confidence as a professional to execute your skill set. And that is where your confidence comes in and you become more successful in that. Repetition helps you grow. Practice makes you grow. And then you start executing those exams like, hey, I know exactly what I'm doing. Okay. And a lot of times when technologists are really good at what they do, a lot of other ones, like if they aren't unsure, you will be the go-to that they call when something goes wrong and says, hey, can I get your opinion on this? Or, hey, can you help me with this? Or, hey, can you start an IV for me because I've tried? So those are the things that you want to execute, but we have to make sure that the training process is set up correctly and set up for success. Start with the protocol bundle because that will be a good reference to add to your CT training, and you can use that as a reference while you're doing your training. So that is it for today's episode. I know it was a little short, but I like bite-sized episodes for you guys. So you guys take the information I'm giving you and then just go ahead and execute and make the best out of your training. So make sure you get the protocol bundles, whether it's the pocketbook or the guide, and make sure you follow along on TikTok and on YouTube for all your CT needs. So thank you so much for joining me in this episode, and I will chat with you guys in the next episode.